I was on radio for a moment there. Coming up next, our next speaker is going to speak on 30 years of the Healthy Islands Vision, realigning the Pacific Health Research Agenda. And that speaker is Associate Professor Donald Wilson, who is a public health physician, an epidemiologist, and an academic leader with a career spanning close to 30 years in public health, epidemiology, and toxicology. He is currently the Associate Dean Research of the College of Medicine, Nursing and Health Sciences at the Fiji National University and the inaugural director of the Fiji Institute of Pacific Health Research, FIPHR, at the same college. Dr. Wilson earned his PhD in occupational environmental epidemiology in Japan, focusing on the respiratory health effects of air pollution in industrial cities in northeastern China. Since returning to Fiji 10 years ago, his research engagement and interests have broadened to include water-sensitive diseases, re-emerging communicable diseases, non-communicable diseases, NCDs, in the Pacific, sexual and reproductive health, planetary health, and particularly the importance of policy impact of Pacific health research works. Kere kere, please put your hands together for Associate Professor Donald Wilson. Vinaka.
Nisayan Ravinaka, Kando Kaitigavi on Mataleniko, Mendurian Matamani, and a song on the Webabuli, and a song on the Wulikatikokin, and a Matakanisinico. Nadango Donald Wilson, O Tamago Kailomani, Totoy, my Lao, Susungama and Nugu Carnivas, my winning book, my tail. Wakavinakati and Gutik on Matakanisico. Wavinakati Colin, Vanavali Reti. Good morning, Bulavinaka, everyone. I was just acknowledging Sir Colin and also saying that my father is a Kailoma from Totoya in Lao, but I was raised by my maternal grandmother in Wainimuka in Tailebo. And such an honor to be standing in front of you this morning to share a few thoughts about what I think is happening in the Pacific as far as my work and my role in research based in Fiji and how we think we can work together. So the title of my talk this morning is 30 Years of the Healthy Islands Vision, which I think we all know, and trying to realign the Pacific Health Research Agenda, again, based on the work that we've tried to do over the years. And so as an outline, I'll talk about some of the health challenges that we face in the region, then share a bit about the Healthy Islands Vision, which again I think you all know, research capacity and the investments towards research, and hopefully trying to share some of the thoughts that I think might be able to revive the spirit of the Healthy Islands Vision and some thoughts on looking ahead. The few photos on this slide depict how the Pacific Island countries confront complex sustainability challenges, high disease rates, inadequate sanitation and clean water, rapid growth of informal settlements, and existential climate threats like sea level rise, increased flooding, and extreme weather. Urbanization, extractive industry, and agricultural development are accelerating ecological degradation, compounding these adversities. So the Pacific Island countries also have made less than 6% progress toward the SDGs, ranking among the lowest globally. They have sharply regressed in key measures of health, food security, climate action, clean water and sanitation, education, and energy. The COVID-19 pandemic and successive extreme weather events have highlighted the challenging nature of the region, including geographical isolation, limited resources, and severe climate change impacts. Despite these challenges, Pacific Island countries boast some of the world's richest cultures and ecosystems, providing unique opportunities to meet the SDGs. As self-contained socio-ecological systems facing a spectrum of global challenges, our countries are crucial locales for pioneering some health research that also includes the planet and action at the health-environment nexus. This is a group picture of, I think, some of the members are in this room at the last Pacific Heads of Health meeting that just happened last month in Nandi. And I will share just a few of the highlights as far as challenges in health across our Pacific countries. Sorry, just the title, the subject on top is Increasing Mental Health Problems. The Pacific is experiencing a rising prevalence of mental disorders, as you can see in that first graph. In 2021, more than 1.5 million people in the Pacific were affected by mental disorders, while at least 200,000 people experienced substance use disorders in the Pacific. And the Pacific Island countries have some of the highest suicide rates in the Western Pacific region. Substance use, particularly illicit drug use, has surged as a critical public and social concern across the Pacific, significantly contributing to the regional HIV crisis. So with substance use, mental health is recognized as a critical public health issue in the Pacific. Okay, so now I know that where I put title is probably a little too high. Another issue that was discussed at the Heads of Health meeting was antimicrobial resistance. This is another problem. It is a global public health threat, and in the Pacific Island countries, AMR is also becoming a growing public health threat. It's spreading across healthcare settings and into communities. We've got capacity for genome sequencing in some of the facilities, revealing the presence of the New Delhi strains of carbapenem-resistant Enterobacteriales. These are called superbugs. The Southeast Asian and Australasian strains and local induced strains of MROs in Pacific Island countries. Inter-country spread is compounded by travel and patient referrals across borders. Some Pacific Island countries currently face significant challenges as MRO infections compromise patient care and clinical outcomes. So as an action plan for the Pacific Heads of Health, through its special networking groups, have a dashboard of activities that each country works towards, which is the table at the bottom. Sorry, the title of that slide is A Growing HIV Problem. I think all of you are probably aware of the HIV problem in Fiji in particular. And on that left top right is talking about the HIV outbreak in Fiji, a growing crisis, 1,093 new cases in just January to September 2024. That's a 3 times increase from 2023 and a 9-fold increase over 5 years. More than 50% of these diagnosed cases are not on treatment, and 50% of new infections are linked to injecting drug use. So there's a response a team with a 90-day plan and a 5-year HIV surge strategy to 2027. The issue of HIV and its regional risk is because of these underlying vulnerabilities in the Pacific Islands. Firstly, Fiji has the second fastest HIV growth in Asia Pacific. Because of the high trade, travel, and education across the region, there's also that high regional mobility, our behavioral risks in terms of low condom use, testing rates and HIV knowledge, and also the increasing intravenous drug use is becoming an emergent threat. Our HIV programs are also quite outdated, 20 years behind at limited prevention. So at the bottom, from the multiple indicator cluster system, this is what UNICEF particularly uses as a survey of country capacities. And so, for instance, in Vanuatu in 2023, because 2.8% of females and 5.5% of males engage in first sex before 15 years, and there's low condom use and low HIV knowledge. So there are some factors for each country of those 4 countries that are shown at the bottom that predispose these countries to the spread of HIV. globally, humanity has crossed at least 6 of 9 planetary health boundaries, planetary boundaries that push the Earth outside its safe operating space. And our Pacific Island countries and territories are at the front lines of intertwined environmental and health challenges, and these are exacerbated through reaching these planetary tipping points. Our region is among the most vulnerable globally to the health impacts of climate change, facing trauma from extreme weather, threats to water and food security, surges in infectious disease, and rising non-communicable disease burdens. Intensifying cyclones, sea level rise, deforestation, and resource losses have eroded livelihoods and strained our health systems. So, I think these very importantly point to the fact that human health depends upon thriving ecosystems. With that in mind, the Yanuva Island Declaration. In 1995, the Pacific Island health ministers gathered on Yanuva Island, Fiji, to declare a visionary ideal, a holistic framework linking human well-being with environmental stewardship. This 4-part vision for healthy islands of the 1995 meeting included one that aspired for ecological balance. Ecological balance is a source of pride. They imagined island communities where children thrive, people live and age with dignity, and ecological balance is a source of pride. At the convening 20 years later, the vision became a 5-part declaration with the inclusion of yet another ecological aspiration, that the oceans which sustain us is protected. The Healthy Islands vision anticipated by decades the core principles of today's planetary health movement. Indeed, as one Pacific health official later observed, the Healthy Islands vision was ahead of its time is now. 30 years on, amid escalating climate and health crisis, that prescient vision now demands urgent realization. I really need to learn how to that title, right? So this slide basically talks about how that Healthy Islands vision has been monitored over the years, the Healthy Islands monitoring framework. This framework of 48 indicators underrepresents the ecological determinants of health. Of these 48 indicators, only 5 reside in the environment or ecology pillar. Even these few environmental indicators are patchily reported. Fewer than half of Pacific countries have recent data, and none have data for climate change and natural disaster resilience. Crucially, the framework omits direct measures of natural system health. There are no metrics yet for forest integrity, biodiversity status, watershed, or coral reef condition, despite their obvious impact on food security, disease ecology, and community well-being. This gap leaves decision makers partially blind to ecological trends that underpin health outcomes. To truly fulfill the Healthy Islands, the original promise of the Healthy Islands vision, I think Pacific health leaders and development partners need to upgrade data collection and indicators to integrate these ecological determinants fully. Monitoring platforms must incorporate indicators of watershed quality, reef vitality, forest restoration, and biodiversity alongside traditional health metrics, and these indicators must be informed by indigenous and local knowledge systems to ensure cultural relevance, ecological validity, and community ownership. Strengthening environmental surveillance and linking it with health information systems will enable proactive, preventive policies, and investing in such integrated data systems and cross-sector analytical capacity, our Pacific Island countries and territories can better manage environmental changes, cascading effects on human health. So looking ahead, realigning our Pacific health development with ecological stewardship requires political will, innovative partnerships, financing mechanisms, and inclusive leadership. Institutional frameworks should institutionalize whole of government and whole of society collaboration towards shared goals. Regional technical agencies such as the Pacific Community and SPREP have a critical role to play in supporting collaboration through evidence generation, policy guidance, and capacity building. Encouragingly, a new generation of Pacific leaders and scholars is emerging with a passion for climate action and ancestral wisdom, driving sustainable lifestyles and holding governments accountable. This shift aligns with broader regional visions, notably the Pacific Leaders 2050 strategy for the Blue Pacific continent and overarching blueprint for regional resilience and health equity. Embracing this idea of planetary health will unite objectives under one umbrella, accelerating progress on climate adaptation, food security, and pandemic preparedness. By marrying ancient wisdom with cutting-edge science and updating success metrics to include the pulse of nature, the Healthy Islands vision can be reinvigorated for the 21st century. The Healthy Islands vision was ahead of its time. Its time is now. At this year's Oceania Planetary Health Forum, held in February this year, we launched the Fiji National University's Pacific Planetary Health Research Center by integrating expertise in public health, environmental and climate sciences, water sciences, microbiology, genomics, ecology, and biodiversity. We want to ensure a comprehensive understanding of the natural and human systems at play. Our focus on policy and systems change, combined with socioeconomics, community development, and urban planning, will hopefully enable us to design and implement effective, sustainable interventions. Moreover, the centering of indigenous knowledge and lived experiences enriches our research, grounding it in the realities of local communities and enhancing its relevance and impact. By bridging these disciplines, we feel that this transdisciplinary research will be capable of delivering holistic solutions that address the interwoven challenges of health, environment, and social well-being in the Pacific and beyond. Just before I leave the stage, so we normally have our annual research symposium, which is happening this year from September 9th to 12th, but at the same time, we have the 140th anniversary of the Fiji School of Medicine. So if you want to be at either, you can attend either or both. So we've had to move the venue of our research symposium to Suva just so that we can be at the same venue throughout the event. Thank you so much. I'm again grateful to Sir Colin and the organizers for the kind invitation this morning. Vinaka.